been diagnosed this year with this illness, most of them children, and doctors say it impacts the body's nervous system, specifically the spinal cord, and can cause paralysis. There are no vaccines, and the exact cause is a mystery. Let's bring in Dr. Frank Gatzberg, pediatric infectious disease specialist at University Hospital Rainbow Babies and Children's Hospital in Cleveland. Doctor, it's nice to have you back on the program.
Jenna, it's very good to be here again. Thank you.
Tell us a little bit about this illness. It's a name that I don't recognize.
Yeah, you know, this acute flaccid paralysis, or AFP, is actually something that we see ever so often. It's very uncommon, it's very rare, but it can happen after any virus. In this case, though, enterovirus D68, which is something that we've been seeing a lot over the last 2 years, seems to have a much higher incidence causing this type of a neurologic response. There are certain viruses that attack your brain, and there are other viruses that trick your own immune system into attacking your brain. And we're not sure exactly what's going on here, but it's probably maybe a little combination of the two. And it's something that we just don't have a good response to just yet.
You know, as a mom, it's really scary to hear about this happening to children, because the children that are impacted by this have paralysis from it. At the same time, as a journalist, I'm looking at the numbers and I'm thinking, okay, 50 cases, that's double the amount of last year. And it is in 24 states. So I think it's important for us to mention it, doctor, but I also want to keep it in perspective as to how rare it is.
Yeah, it is very rare, but it is very devastating. It is something that we as pediatricians look for any child that shows up with weakness or limp or slurred speech out of the blue. But you have to understand that when you put it into context, how many of your children get a viral illness? Well, basically all of them get a viral illness, usually several times throughout the winter. This is actually a very rare problem, but it is because it is so severe and that it can be completely debilitating. Many children can get regain of function, but some of them remain paralyzed for a prolonged period of time. And so it's important for us to get to the understanding of exactly how this is happening and why.
So what would it look like for parents? They would see their child potentially just with what would seem like an average cold, an average virus, and then what else should you be watching for?
Well, a lot of times it just happens after a fever. Sometimes you'll have, running nose and cough, and sometimes you don't. But usually it happens when, depending on the age of the child, some children will just start refusing to walk. Some children will have weakness and they'll start favoring another arm or a different part of their body and not using one arm or one extremity. Sometimes it's actually in the face. You start seeing drooping eyelids, they're not able to smile with both sides of their mouth. Or they start even having trouble with speech because the tongue is a muscle and it can become weak, or swallowing. And they are able to they're drooling more than swallowing. And in those cases are actually the more severe, because when you cannot control your secretions, you can actually get a very bad pneumonia.
So what should parents do? What is the treatment for this?
You know, a lot of the treatment is protection of the child. We actually try to maintain their airway, making sure that they're able to swallow okay, making sure that they're able to breathe okay. Also, a lot of times there's no standard treatment, but a lot of therapies have been tried with varying results. Some actually work well when we use some sort of immune therapy to tone down the immune system. Other times we actually just monitor the kid and watch them and work on physical therapy, speech therapy, in order to regain the function that they've lost.
So just if you could give us kind of a big picture perspective, because parents, of course, are always worried about their children. How do you place this going into the winter season with just the fact that most of our kids are going to get a virus? Just give us some context for how concerned we should be.
Well, this is unfortunately, we are born onto an inherently dangerous planet with bacteria and viruses and shark attacks and all that. And this is nothing that we're going to be able to avoid altogether. However, the best way to prevent this and other complications is to do your best to try to minimize how many viral infections you get. The best way to do that is with good hand hygiene. In order to wash your hands will prevent the transmission of viruses to you, as well as you preventing the transmission to others. In addition to that, if you're sick or your child is sick, is to keep them away from other children to prevent the virus from spreading as well.
It's funny how many conversations, I don't mean funny, but it's interesting how many conversations come back to just wash your hands. And it's a reminder. It's a reminder to parents. I know I need it. Dr. Esper, great to have you on the program. Thank you very much.
Very good to be here. Bye-bye now.